Yu Ping Feng San, commonly translated as jade windscreen powder, is a classical traditional Chinese medicine formula in the category stabilize exterior and tonify Qi. Its core action is to tonify defensive Qi, stabilizes the exterior, and reduces spontaneous sweating. The pattern framework is Qi deficiency with susceptibility to exterior invasion. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is Qi deficiency with susceptibility to exterior invasion. Typical clues include spontaneous sweating, aversion to drafts, fatigue, recurrent mild respiratory illness, pale tongue, weak pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Huang Kai, Baizhu, Fang Fang. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses glucose-lowering medicines. Tonic formulas containing ginseng, astragalus, or other metabolically active herbs may change glucose control in some patients. When insulin, sulfonylureas, maglitides, or other glucose-lowering therapies are used, the clinically relevant issue is additive hypoglycemia. Use home glucose data and adjust only through the appropriate medical prescriber. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses immunosuppressive therapy. Astragalus and several tonic herbs have immunomodulatory actions in experimental systems. That creates a theoretical or clinically relevant concern in transplant medicine, autoimmune treatment, or oncology regimens that intentionally suppress or modify immunity. The direction and magnitude are not reliably predictable, so specialist review is appropriate. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Recurrent infection, fever, immune deficiency, or severe respiratory symptoms should be evaluated medically. Discuss use with immunosuppressive therapy. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Yu Ping Feng San is best understood as a pattern-based prescription, whose action is to tonify defensive Qi, stabilizes the exterior, and reduces spontaneous sweating. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen, and current drug interaction and pharmacology references.